Meet. I welcome you all on the 10th edition of Clinical Meet of Academy of Hypnosis. And for today's meet, we have two wonderful presenters with us. First presentation is going to be by Dr. Pankhuri. She's a dermatologist and she's currently working in New Delhi, AIMS Hospital. I welcome you, Dr. Pankhuri. And she's also doing her psychodermatology from Oxford Bast Hospital Trust, NHS London. She's a highly qualified professional, and the topic of her presentation today is use of hypnoanesthesia for perioperative anxiety in children. So, Dr. Pankhuri, we have made you the co-host. You may now start by sharing your presentation, please.
Thank you, Nidhi. Is my screen visible?
Yes, visible.
Perfect. Thank you. Yes, thank you, Nidhi, for the very kind introduction. I started learning about hypnosis after getting into psychodermatology, and I was very interested in its future applications for dermatology. So I started focusing on among other applications within hypnosis, I started focusing on the last one, which is anesthesia as a part of dermatological procedures as a standalone and as an adjunctive process. Like patients do undergo the injectable, topical, or regional anesthesia using lignocaine, but we also use hypnoanesthesia to improve its effect as we come to later. Perfect. Yes. We already are familiar with this. Many of us who work with hypnosis for pain reduction, it is of a similar process in terms of inducing anesthesia, except the pain is not already there. We're inducing anesthesia in anticipation of pain. So there's gate control of pain with this effect. There's effect and modulation of the anterior cingulate cortex and the way pain is managed here. There is parasympathetic stimulation overall, as we know, and overall reduced sympathetic drive. This is generic. It's not ubiquitous across all systems. For example, we know that the mouth goes dry. So it is, but however, overall relaxing and parasympathetic stimulation is part of how hypnosis works. And its own physiological changes as well, inflammation, etc., gets reduced, as most of us who work with pain have already seen. So with respect to anesthesia, one of the three target areas within anesthesia is anxiety of pain. So coming to anxiety, when we were working with children, by using magic glove technique, we know we are able to induce anesthesia very well. However, the challenging cases are those who have a very significant level of anxiety. And if they are not already familiar with the technique, if they already don't trust it, or especially if they have undergone previously painful procedures, then anxiety becomes the main factor to target because the child would simply not come into the OT at all. And you won't be able to even talk about getting the procedure done. So why target anxiety? We are sort of also familiar with this overall as people who have experienced both anxiety and pain. But there is enough evidence to show that there is a direct relationship between the degree of anxiety and the degree of perceived pain. And also there is a lower threshold of pain. So the point at which the patient says that I cannot take this anymore would be a lot lower, much lesser pain if the patient is already anxious as well. It has been seen overall for many, many years, but this is the most recent review that covers this in much detail. Also, there is a reverse relationship as well. So there is decreased anxiety also reduces pain perception, as has been seen in this very nice study in which they recorded in real time how breathing intervention changed how much pain was being perceived to the same stimulus before and after. Also, when we are talking about anxiety, why are we addressing it? One is taki pain come. Dusra, regarding experience of surgery, both for the child and for the patient, not in terms of how good their experience was, but in terms of how traumatic it can be. And now there is also a growing recognition for the fact that patients who have undergone trauma, especially surgical trauma, find it more difficult as adults to go to hospital to especially undergo any even minor procedure. And they are the ones with needle phobia, white coat anxiety, etc. So there is a correlation. Many of them have earlier procedures, especially dental procedures. Also, there is a very interesting paper in which they examined the effects of the concept of powerlessness. All of us who have ever been patients, we know that when we walk into a hospital, from when we will be seen to what the doctor will say we have to do to what procedure we will undergo to when we would undergo it is none of it is in our control. And this sense of powerlessness is over the overall very bad experience that going to the hospital overall is. And that also feeds into anxiety and pain. So there is a relationship between these three. And now, how we normally tend to especially deal with children are the things that we say. So these are all things which increase the sense of powerlessness. And although they make us as practitioners feel more powerful, they actually, and they might actually be even effective because bacha pareshan hoke kara leta hai procedure. But that does not mean that we are improving either the tolerance to pain or the experience. जैसे हम बच्चे को बोलते हैं तो करवाना ही पड़ेगा, try to bully the child, बोलते हैं देखो आपके पेरेंट्स इतनी मेहनत करके आपको यहाँ लेके आए हैं, then comparison with other patients, उस बच्चे ने तो देखो कितने प्यार से करा लिया, आप कितना परेशान कर रहे हो, ridiculing them for crying, public shaming, कि दूसरों को बोलना देखो देखो बच्चा रो रहा है, then stigmatization कि बच्चे लड़के तो नहीं रोते या लड़कियों की तरह क्यों रो रहे हो. And the last is fear, the worst one, which I think a lot of like maybe older people tend to use is चिल्लाए तो और सुई लगाऊंगा, something like that. And also wrong expectation. A lot of us think कि अरे अरे बेटा बिल्कुल दर्द नहीं होगा, कुछ भी पता नहीं चलेगा. But that actually makes the child feel cheated when he does actually have pain. So even with a 3 or 4 year old child, taking them into confidence, making them feel a part of the process. For example, अगर आपको कोई दवाई दिन में एक बार लेनी है एंड यू बीइंग टोल्ड कि हाँ ये एक बार लेनी है या इस टाइम लेनी है, अगर डॉक्टर आपसे पूछें कि आप दिन में किस वक्त ये लेने में सबसे कंफर्टेबल फील करेंगे, योर चांसेस ऑफ एक्चुअली बीइंग एबल टू टेक दैट मेडिकेशन, योर कंप्लायंस एंड योर ट्रस्ट विल इंक्रीज बिकॉज यू फील दैट यू आर अ पार्ट ऑफ योर ओन ट्रीटमेंट एज वेल. इट्स नॉट कि आपके शरीर के साथ कुछ कुछ किया जा रहा है, यू हैव नो कंट्रोल ओवर इट. So, sorry, yeah. Also, this is a very interesting phenomenon I saw in children. There's this concept of interoception, which is कि आप जो भी महसूस करते हैं दिमाग में, वो बॉडी में भी फील हो रहा होता है उस वक्त, and that actually feeds it. We use this to deal with anxiety and PMR. We know that the basal tone increases, and we increase the tone in order to later decrease the tone. However, even more subtle sensations related with that particular emotional state are felt very well in the body, and this is what also feeds that state. So often we don't feel that anxious, but if our body has sensations similar to anxiety, we will start feeling anxious as well. And then we start, so that anxiety that follows the anxiety feel felt in the body is what can be meta anxiety. So anxiety of having anxiety. And this feeds each other as a loop. So all of this background is in order to understand how we can actually use it most effectively to deal with anxiety in children. So these are the things which I do not have very clear references for, but based on whatever little work that I've done, that it is best done with prior experience with the same person. So if you have met the child earlier as a hypnotist, then the patient knows that you're familiar. So when they come in for the surgery, among the sea of very unfamiliar faces, there's this one very familiar face that they have had a previously pleasant interaction with, and more than one contact to feed in that same trust. And if at all the first contact is on the day of the surgery, which happens very commonly for me, like बच्चा रोने लग जाता है ओटी में, उसके बाद वो मुझे बुलाते हैं. तो आई नीड टाइम टू बिल्ड दिस रिलेशनशिप. तो ऐसा नहीं कर सकते कि सिर्फ 15 मिनट आपके पास अब फिर सर्जरी करनी है. जितना टाइम बच्चे को लगेगा आपको ट्रस्ट करने में, उतना टाइम देना पड़ेगा, which can be 15 minutes, which can be 2 hours. Also, the hypnotist must stay throughout the procedure. अगर आपने ट्रांस में डाला है किसी एडल्ट को भी, या अगर आप किसी बच्चे के साथ भी बात कर रहे हैं, so this is something I did and then realized that if I leave, then the magic goes away, even if the child was told that this is our own magic, and the child is back to being as anxious and as much in pain as earlier. And also, if we teach the child in advance intraoperative self-regulation के techniques, so tell them that they might feel fear instead of saying कि दर्द होगा, which can also sensitize them to the pain. But अगर आपको डर लगे, because डर is normal, या अगर आपको लगे कि आप परेशान हो रहे हो, तो आप ये चीजें कर सकते हो, which includes PMR, breathing awareness, box breathing, anything that the child seems to respond to. And you must teach, if we teach them in advance, we make them do it with us, then they are more likely to be able to do it in the OT when they are experiencing pain or fear. So also the child feels that, okay, if something happens, I am prepared. So they feel less anxious. So overall, building a rapport and trust, this is the most important part. The child should feel that you are on their side. Distraction techniques, we very commonly use it very instinctively with children. ये देखो क्या है, बच्चा अच्छा अपने दोस्तों का नाम बताओ. This is more for when the child is in pain. Then breathing awareness in PMR, we are already familiar with. So again, if we have taught this to child in advance, then while the child might be having some degree of pain, we can walk them through it again. कि जैसे हमने सिखाया था, चलो ये करो. Magic glove technique works as both as a hypno-anesthesia technique as well as a technique to reduce anesthesia. This was in this paper by Dr. Leora Kuttner, and this was also seen in a patient of mine, as I'll demonstrate. And psychotherapy itself, it's very interesting because normally we think of psychotherapy something that is done over many sessions, but the most challenging case that I will come to, I actually used this to understand why the patient was having the anxiety and addressed it. So this is a very good video on magic glove technique. If anybody is interested in learning, this is Dr. Leora Kuttner. She is very good at this and explained very nicely in this. So this was a 12-year-old male child. I discussed this in the conference for those of you who are already there. So he had a very painful sclerotherapy session once. Then the second session was one abandoned session because he did not, he came all the way to the OT table but then ran away. He was very, very anxious. And then I was called in. So in the third session, I spent about half an hour, 45 minutes talking to him, teaching him how to do breathing awareness. And once he was comfortable and calm enough to follow my advice, we did the magic glove technique. And his father was also very anxious about him because the fact that he had previously run away. So this video I had made for his father. So a child who had previously run away from OT is very clearly saying he's not afraid anymore. Also, this is within the OT. So this was another thing that I noticed, that if the hypnosis or the magic glove technique is being done in a very calm space, alone, you and the child and the parent are the only people there. And then we shift them to the OT where there's a lot of sounds, the machines beep, there are many people all around going in and out. That place itself can induce a lot of anxiety and a lot of the calmness is lost. So if we do this either in a that's more closer to the OT setting where they're still familiar with the noises and stuff, it helps them to not become more anxious and for us to lose all the progress that we have made. This is another case. This was the one where I learned. So it was a 6-year-old girl and had previously 2 abandoned procedures. She had a congenital malformation over her genitals. The magic glove technique was very successful. She was able to follow our instructions. I was able to elicit that the pain was 0 over the hand with the glove and the site of surgery. However, I left to talk to another patient after speaking to her for about 45 minutes. And then when the local infiltration was done by the person who was performing surgery that day, the patient had significant anxiety, cried a lot, was in a lot of pain, which was exactly how it would have been had there been no magic glove. However, there were the 2 abandoned procedures because she would not even go into the OT. So she had her anxiety low enough to be able to go into the OT, but not as low as we would actually like, and which I think would have been had I stayed. This was the 8-year-old girl who had no previous procedures. So that's another interesting thing I've seen, that kids who have had previous bad experiences, previously run away from the OT, they are more difficult to work with because they know exactly how painful it is going to be. So the ones who have never experienced it think that, yes, magic is real, everything is going to be good. And if I say that it's going to be good, they believe me. So 1 week before the surgery, again, this is a video. So now she knows that this magic works. Now, when she actually came for the procedure, this is that day, she gave me the glove from her pocket and she told me, kya pehna. And during the procedure, she's completely comfortable. Now, this procedure is called PDL, pulse diode laser. Now, if any of us, I don't think we would have undergone it. It's a very specific laser for red lesions, lesions with blood. Now, the way it hurts is if you put it on your own hand, it hurts like as if एक rubber band खींच के छोड़ा हो और वो पटाख से जाके लगता है. And how you would wince if that happens to your hand. And that thing is happening to her face. So even with topical anesthesia, children do not tolerate it. And even adults find it very hard to tolerate. However, as we can see, she's undergoing the procedure and there is no wincing on her face. She is completely comfortable. And I am in the OT and I'm intermittently talking to the child to know because her eyes are covered. Now, as we know, lying down and eyes covered are 2 things which also make the child feel very vulnerable, would make anyone feel vulnerable. So the fact that she has her eyes covered, I'm compensating for that by continuously talking to her. So I asked her if she had pain and she's very happily saying that there is absolutely no pain. She was completely comfortable. So then I was called in for a 12-year-old boy. He had 2 abandoned procedures. So topical anesthesia लगाया था और उसके बाद फिर उनको बोला कि जब जैसे ही first laser hit किया, he's like, sorry, I cannot deal with this, and he left. So I had a meeting with him prior to the day of surgery to see how he was following the magic glove instruction. He was following them very, very well. And on the day of the surgery, there was the same topical anesthesia was also used, which had previously been ineffective, and hypnosis, which is magic glove, was added to it. At the end of the laser, this is a very interesting video. Now, for a reference, the child has applied magic glove, according to him, all over the face, but he did not apply it at this part of his right jaw, if you can see my pointer. However, the cream was applied all over this. So the cream was there in this main area as well as the area of the jaw, but the magic glove was not on the area of the jaw. So very interestingly, the topical anesthesia was still ineffective, but the hypno anesthesia definitely worked. So this was another girl. She had this congenital anomaly of nails. So we had to remove the nails. As we can see, we have removed in these two because these nails obviously are difficult to live with. And she had these two successful procedures. Um, and she was very confident. I was talking to her. Magic glove technique was applied successfully. She was able to self-regulate very, very well. I remember teaching her how to do box breathing, how to do PMR, and she was able to follow it. However, when she was on the table, before local anesthesia could be infiltrated for her, she started crying and refusing the local anesthetic injection. So I asked her to do the breathing as we had discussed. I asked her to do PMR as we had discussed, and slowly her anxiety reduced. And also, I used positive psychology in the sense of telling her that she has undergone it successfully earlier, and earlier she had been able to do it even without the glove. So now that she has the glove, the experience has to be not as bad as earlier, and she has already undergone it. She can do it again. So she has this strength within her already. So she allowed the injection and the surgery was successful. We were able to actually do it for 3 digits this time because of the support of anesthesia. This was the case that taught me the most. So this girl had so there's something called verrucous epidermal nevus. So she had thick birth marks all over her body. She had 3 abandoned procedures and one very small successful test area which had been done. So again, magic glove technique, she was very comfortable following, very good confidence. I asked her if she was scared and she said no. And I asked her if she was scared before I spoke to her and we did the magic glove technique. She said yes. So now she was comfortable. However, on going to the table, she started refusing a local anesthetic injection, saying, I do not want it. We tried to convince her that there is the magic glove, and if she undergoes the injection, it's not going to hurt, most likely. And if she does get the injection properly, then it's definitely not going to hurt her because, as she knows, I had taught her PMR and box breathing. We did it on table as well. However, her anxiety would reduce a little and then she would start crying again. She would think, I don't want it. I told her that, all right, so why don't we go outside the OT to the room right opposite and let's talk a bit before she chooses to go back home. And she's crying continuously. And I'm trying to ask her if she can tell me what is the reason for crying. So this was a bit of psychotherapy. Spoke to her for 45 minutes and she wouldn't tell me the reason for crying. And then I asked her if she was afraid that she would get scolded for the abandoned procedure. And she nodded. And then I asked her, who do you think who's gonna scold you? Parents, grandparents? And for everyone, she said, no, nobody, none of them. So I said, oh, so are you afraid that you're letting them down if go home without a surgery? And she said, yes. So I then proceeded to explain how she was 10-year-old and she's a child and she gets to do this. If she doesn't feel comfortable, she doesn't have to. And I also convinced her. Then she opened up and started telling me that everybody at my house is telling me I'm so lucky to get a date at AIMS and I should be grateful. And मैं मना करके आ जाती हूँ, 3 abandoned procedures. So she had gotten a lot of guilt tripping from everybody at her house. And at that time, I told her that, okay, so what I'll do is मैं एक बहुत बड़ी सी पट्टी लगा दूंगी तेरे हाथ पे, सबको लगेगा कि तूने कुछ बहुत बड़ा procedure कराया है, तो कोई तुझे नहीं बोलेगा कुछ. And I told her that like I'm with her on her side. So I implied that she does not have to undergo anything. There is absolutely no stress, no reason to be forced. And also positive psychology, very interesting. So I asked her if she had siblings and she had 2 younger ones. And I told her how nice it would be to be able to tell your siblings कि आज मैं इतना बड़ा procedure करा के आई हूँ और मैं बिल्कुल नहीं रोई. So and the fact that she has previously undergone the injection, she knows how much it's going to hurt and she has already borne that pain. So she knows that it's something she can undergo. On the table, however, this was the part about interoception. She started hyperventilating and she started feeling very uncomfortable. And she's verbalizing this that I don't know what's happening to me. I feel very, very tense in my body. And I explained how fear is also felt in the body. And as she now knows that the injection will not be painful, she can use breathing awareness to get out of it. And I showed her a video of another patient undergoing a much bigger surgery at the same site as her after a local anesthesia. So I told her that this is how strong that injection is if she gets the injection. And magic glove effect was tested, so it was still on. The place was she didn't feel any of the prick. And at the end, I told her to count to 10, close her eyes and count to 10. And at the end of 10, I will inject her. But while she was counting, I started injecting with a very thin needle. There was no wincing. She didn't realize that I was injecting the local anesthetic. And by the time she finished counting, the local anesthesia had been injected and the effect had come. So she was able to undergo the procedure without pain. At the end of the procedure, I talked to her that now she knows that she's strong enough. She can get it done again because she had these birthmarks all over her body, so she would need another session. And she was very confident that yes, she can do it. And the way the child walks out of the OT, so normally if they have had a very bad experience, they are slouched, they're crying, and they never want to come back again. But if this is the way they walk out with confidence. They are much less likely to have any trauma of having, because the trauma is psychological. So they're much more likely to be able to come back for another procedure and also eventually as adults not have much problems. So what I've learned so far is that it's very important to stay on for the procedure. We have to keep on reading the nonverbal cues of the child. They're not going to always open up very easily. And we have to sometimes make assumptions in order to make them say yes or no, ask leading questions. Then we have to resist the tendency to bully, force the child, or shame them about crying. Our culture is so commonly using these phrases with our own children as well. We have had our parents use it on us, so it's not pleasant at all. Then obviously a lot of patience. Then reasoning with them like adults also work. They are not stupid. They understand what we are saying. Taking them into confidence also helps. Then how good it would be when either they don't have the lesion or when they are able to tell their friends that they underwent something which was so hard, being on their side, even if it seems to be against parents, and helping them talk to parents if they feel. And one of the things that last girl said was, "Aap mere papa se baat kar loge." So yes, telling them that if it involves that, you will do that. You won't sort of leave them to the berating of the parents. And helping them help themselves. They don't always have the vocabulary, always have the ability to verbalize what they are feeling. And also, this is something I have I'm sort of sharing, is that I keep looking for ways to improve. Every child is different. And I've only shared the difficult cases here. Magic Glove Techniques works really well. About 50 odd cases we've been able to do very easily. These were the tougher ones where I had learning points to extract from. So that's it from my end. And we can discuss this topic, or I think it might be after the next talk. Thank you.
Hello. Yeah. Avnish sir?
Yes.
So shall we take the questions right now, or should we continue with another topic?
So how the schedule is going on?
Yeah.
Accordingly, like if we are ideally, it is good to take the questions immediately, but we keep a limited time for that. And next is the session of Madam Sita Prana.
Yes, sir. Dr. Nima.
So
we
yeah,
have
Dr.
Dr. Dayal Mirchandani with us as well, sir.
Yes, sir. So we would first, let him comment or ask something. Dr. Dayal, sir, please.
Good evening, sir. Dr. Dayal.
Good evening. Wonderful presentation. And nothing, no negative feedback, but I just think that it was really good that you went with 50 cases. That's something wonderful. Hopefully your other colleagues are learning on.
Yes, sir. Thank you.
Yeah. And there are some, apart from Magic Glove, there are other techniques. As Dr. Sugarman, Lawrence Sugarman, he has some videos also. Maybe you can contact me at some point and I'll give you the link.
Yes, sir. Thank you. Thank you. That's very kind of you.
Yeah, if no one has question, I have few things to say. So I must congratulate Dr. Pankhuri, and really, you have done a wonderful work, and you are keeping a very good data and record of it, and you have mastered these techniques. My two suggestions to this: first of all, you have done it fantastically. I have two suggestions when I was going through your talk. that one thing is of using, trying to use more of positive words, especially when it comes to pain. When we use the word pain itself, we are triggering somewhere in the mind the mechanisms, and that actually increases the anxiety. So instead of pain, the word comfort. This is what I have learned from Palan sir since years, that using the lighter and milder words and softer words, though we are intending to point on the same thing, but always trying to make the words as soft and as soothing as possible. So trying to avoid asking the patient that do you feel pain. Instead
Right.
of that, use the word that I am sure you are feeling comfortable.
Right.
You are feeling, instead of fear and anxiety, I am sure you are feeling very strong. You are a very brave child. So this is what we create a kind of aura of our perception. I would just sum it up fast, because when it comes to pediatric hypnosis, I have a tendency to slip into. But whenever the child, you feel you create your own image, because the child is always depending on you to define himself or herself, what you perceive about the child, because they are like a blank slate. So whatever you say them, they start believing it. And so always create a very positive image of the child in his or her mind. The child always feels कि डॉक्टर ने मुझे ऐसा कहा, हाँ, and then he keeps on telling it to everyone कि मुझे डॉक्टर ने ऐसा कहा. So as a doctor, the word matters a lot. And so if you create a very positive image of the child starts believing it very strongly. So this is what, and another technique was whenever you are using this magic glove, it's wonderful. Also use imagination very early. In adult breath watching and PMR, we are not using it, but my experience with pediatric hypnosis is that they are more imaginative, and they have less patience who follow the structured thing. If they are following it, is very good on your part. But you take them to imagination very fast, and they are very spontaneous to imagine things. So you can start using imagination as soon as you start this structured breath watching or PMR. You can in between keep on putting imaginations. And second was that along with this, you can also use that snow. I always use that, you have your hands inserted in the snow, or there is a snowfall. So whenever you are using snow, it has two physiological effect, that the child knows that the snow is cold, and cooling itself creates numbness, and it will also cause vasoconstriction. This has been observed physiologically.
Right, sir.
So it will cause vasoconstriction, and whenever you are using any surgical procedure, it will also reduce the bleeding. That will be an advantage. After once you have done the procedure, you have to reverse it, because the vasoconstriction then can continue. So unless and until you don't reverse it, so now you can say at the end that now you have brought out your hands and there is a sunny light, and you see the sunlight falling on your fingers and it is feeling the warmth, it is coming back to normal. So that you have to add at the end. Otherwise, the vasoconstriction may persist.
Right, sir.
And that's what I have to sum up in fast. Thank you.
Thank you so much, sir. Very, very helpful suggestions, sir. I put them into practice and let you know.
Sure.